Let's take a moment to outline some of the different prescription medications out there to treat erectile dysfunction, and what you can expect as you're considering which medication may be the best fit for you. To start, the prescription medications are generally split into two categories: medications that you take every day and medications you take before a planned sexual experience. Let's start by discussing the everyday medications. Many men may have never thought they would need or want to take a medication every day for their erectile dysfunction because they only make love once or twice a week. However, for many men with ED, they often lose themselves in the stress and anxiety of ED. They may even lose confidence because they have lost something that inexplicably defines them as a man. As a young man, waking up with morning wood is common and even expected, and you learn to accept it pretty quickly. As you age, however, life becomes complex. In middle age, men can begin to lose their morning wood. This is because as we age, our sleep cycles change. We lose a phase of our sleep cycle, particularly in the morning. This phase is called REM sleep, and this is the phase during which morning wood is possible. For men who have been consumed by the stress of ED and consistently think about it, the return of morning erections can be restorative, revitalizing, and affirmative. Daily tadalafil, also known as Cialis, can restore morning wood and restore a sensation of joy that everything is functioning appropriately. Converting this functioning into satisfactory intercourse takes a little more work, but restoring an erection is the first step. Ultimately, if you think you would find confidence in regaining morning erections, you and your partner make love multiple times a week, you are in a new relationship where lovemaking can be associated with some performance anxiety, or you are a man with urinary symptoms related to BPH, the daily medications are a great choice to consider. Let's move on and talk about the medications that you take intermittently when you are planning to make love. Medications like sildenafil, also known as Viagra, are shorter acting drugs that are absorbed much quicker in the gut, meaning they have a quicker time to action. Because these medications are absorbed into the blood quickly and act rapidly, their effects of increasing blood flow aren't always specific to the penis. Therefore, there can be more side effects like flushing of the face, nasal congestion, headache, and heartburn, all of which are products of the same actions that all these medications have on the penis, just in different places of the body. These medications are understandably better for men that plan and can predict their sexual activity, or for the men that have used them in the past and have not experienced significant side effects, as these side effects can be one of the major deterrents for this category of medication. However, some men prefer to experience the side effects because they know the med is working. These medications can be a good option for some men because the effects are seen rather quickly, making it relatively easy to titrate the dose for the next time to maximize the positive effects and minimize side effects, meaning you are only taking the amount you need. In addition, most of these short-acting meds have to be taken on an empty stomach and require some planning around food. However, the daily med tadalafil can be taken irrespective of food. Ultimately, the choice between daily medication and as-needed medication is person-dependent and should be a decision that takes into account your sexual schedule and your tolerance of potential side effects. For many men, finding the right medication is trial and error, but experience with medications can be helpful in knowing what's right for you. At Zested, the patient information you will fill out will give us information and allow our experts to prescribe daily tadalafil, short-acting sildenafil, or a combination therapy of both.